ahead, since we're still kind of waiting for a little bit of numbers and people joining. Mayor, do you have anything you wanted to address here at the beginning of the press conference?
Yeah, I just wanted to let everybody know to make sure they watch the ECISD Facebook Live at 7 o'clock tonight. They will be telling what they're going to do. It will also be on YouTube Live. So that way you can find out the latest what they're doing. They've been working very hard, and I'm very grateful that they've been working as hard as they are. It is a moving target, just like we've always talked. So 7 o'clock tonight, that will be online. That's all I've got.
Thank you, Mayor. Eddie said he's waiting on numbers. We should have him here in the next 5 minutes. We do have Stacy on the phone. Russell is actually on another conference call. So, Kristen, do you want to go over the MCH numbers?
Sure. So total in-house today, we have 42. We have 12 critical care patients, and 7 of those are vented. We have 12 on 7 Central, 16 on 8 Central. We do have 1 on our postpartum floor, and we also have 1 on pediatrics. Another couple of things just to mention is we've received several transfers from Andrews. So we're kind of watching the situation that's going on over there. And then we've been speaking to our friends down in Fort Stockton, kind of evaluating what they have going on and what they've been sending us so that we can keep a good pulse on what those 2 specific areas are doing, since we are seeing some uptick in their cases, or at least the transfers that they're sending us. And I think that's it, Trevor.
All right. Thank you, Kristen. Stacy or Dr. Sarah Bannon, one of you want to go over the ORMC numbers?
Yes, Trevor, I'll do that. Odessa Regional has tested 1,524 people, 293 positive. We have 18 pending at this time. We currently have 17 patients in-house. 14 of those are in ICU, with 9 of those on a ventilator, and 3 are on our med-surg COVID unit. We have, of those, 4 are from, 1 is Courtyard Assisted Living, 1 from Reeves County, 1 from Crane, and 1 from Big Lake. So 4 of our 17 are from those particular facilities. Otherwise, the patients are Ector County. That's all I have, Trevor.
Dr. Sarah Bannon?
One quick update for today. The CDC did recently release, a few days ago, new guidelines for discontinuing isolation or precautions for people that have been COVID positive. Before, there was a requirement for 2 negative tests, which were greater than 24 hours apart, or the symptom-based strategy. So now the CDC does not support the test-based strategy anymore. It supports the symptom-based strategy more. The main reasoning, and there's a long article that explains their thought process, but the main reasoning for this is because people that are testing positive even more than 2 weeks out are not shedding the virus anymore, but are still continuing to test positive. So they're not infectious, but they're still continuing to test positive. So the test-based strategy is no longer to be used, and the symptom-based strategy was updated with a couple of different numbers. 10 days since when your symptoms started, and 1 day without symptoms, without use of medications. That's different than the 10 days without symptoms since symptoms started, and 3 days without symptoms. So now it's 10 days since symptoms started or your positive test, and 1 day without any symptoms without using medications. And that applies to people with mild to moderate illness. People who have severe illness, especially people that were hospitalized, their cutoff is 20 days from when all of it started, and 24 hours without any symptoms, not using medications. If that's confusing, I expect it to be, because that's a lot of numbers. So it's on the CDC website. If you go to CDC, discontinue isolation for COVID, it'll give you those numbers.
All right. Thank you, Dr. Sarah Bannon. Eddie, do you have the numbers by chance yet?
Yes,
okay.
I do. Okay, the county numbers, total active cases are 1,142. We have recovered 1,483 for a total tested of 13,608. Negative tests are 10,187. Test pending 762, and we've had 34 deaths. The The total case number will be updated on the website by 5. The Ector County Health Department has updated their website with information on the deaths by age and groups and genders. And 30% of the deaths in Ector County are nursing home related. Nursing home updates. Focus Care has total cases of 22 with 10 active cases. 12 have recovered. We've had 3 deaths. Sienna Nursing Home, total cases 56, active or 32, recovered 17, and 7 deaths. Madison Medical Resort, total cases 7 with 5 being active, 2 recovered. Deering's Nursing Home, total cases are 2 active. Courtyard Assisted Living, total cases are 5. Buena Vida Nursing Home, total cases 3 with 2 active and 1 recovered. And that's the Health Department's report.
All right, thank you, Eddie. Looks like we can get to questions now. First one I see is, looks like Mike Merlot, Odessa American.
Hi, Trevor. Yeah, I guess I had questions for the hospital, both of them. Is there, are y'all seeing a rise in people asking for experimental treatments? And I guess are hospitals doing those more often if people are asking for them?
So at Medical Center, we are actually, if we do have a fair number of people that will ask for specific treatments that they've done their own research on, they've had questions about. So our physicians will have those conversations with those family members, with those patients, to kind of see what they're thinking, what they expect that outcome to be. And many of them are trying them. I mean, what is it going to hurt? And so we do see a fair number of our physicians go ahead and accommodating those requests. If it's not going to harm the patient in any way. I know we had one just yesterday that they asked for some specific treatments, and we've tried those to see if we can get any results out of those.
Only thing
Is there some sort of process?
I'm sorry, I just wanted to add one thing to that. At this point, because this virus is so new, pretty much all the treatments are experimental. So there's still guidelines being developed, and they're changing all the time. So we, as a scientific community, we look at the NIH COVID-19 treatment guidelines. The NIH COVID-19 treatment guidelines are the ones that are probably the most comprehensive and reviewed by the people in the scientific community. But exactly like Kristen said, if someone asks for a certain treatment, a doctor will do research about it, and then the doctor will decide, does it make sense? Would it cause harm? And if it wouldn't, then they'd be willing to try something that wouldn't cause harm.
Okay. Is there a certain timeline for, I guess, a doctor to make a decision on whether to use one of those treatments?
I don't know that there's a timeline. Since one of our physicians is not on the phone with us from our side today, in my interactions with them, it's really they have those conversations with the family, they're assessing the patient, they're looking at any of the lab work and current treatments and making sure that one's not going to interact with the other. And so I think it's just a matter of the timeliness of those conversations. I don't know that there's an actual process other than just the time it takes to evaluate the current situation.
Okay.
That's exactly right. Thank you.
And I guess, as far as Sarah Vannon, you had that doctor on earlier who kind of talked about how important communication is to patients and how that was kind of difficult. Are both the hospitals, are y'all able to kind of tend to families of COVID patients as much as you'd like?
I don't think at Medical Center we tend to them as much as we would like to, but we're doing the best that we can with them not in our building. We call all of our patient families between the hours of 1 and 3 every day. That gives us time to round with our physicians, and then the nurses call. So if they are caring for 5 patients, they call all of their one support person that they have listed. We review over any questions that they have, any concerns, what the doctor's plans are. We kind of give them status updates. So we're trying to reach out to those individuals on a daily basis.
Okay.
Yes, daily communication is very important, and there is time set up to call the patient's family. It usually happens after rounds, so the doctor has the most up-to-date information to be able to discuss with the family. But again, as much as we would like would be keeping the family updated about everything that happens with the patient. And so no, we don't get to do that with the patient's family not being there all the time.
Okay. Okay. Thanks for that. Is there, you know, I guess some places are doing the like FaceTime. Is there any opportunity for that? Does it have to be scheduled?
We at Medical Center try our best to work with the families. So when we call a patient upon admission, their family member, we'll find out some good communication times. It's really just kind of dependent. I mean, when we have a second, when they have a second, we have the Zoom capability, we have the FaceTime capabilities. So we're just really trying to accommodate them as well as working around the care of the patient.
Okay.
Yeah, it's not scheduled, Mike. So whenever there is a need, and there's those units, those iPads physically sit in the COVID unit and can be used for multiple patients, depending on that availability as well.
Okay, thank you. And my last question, I guess, you know, should people be hesitant about going to the ER right now? Is that a worry that medical professionals have right now?
I'm going to say no. You come to my ER and I'm here to guarantee your safety. That's why we ask you to wear a mask. We provide the gel, our staff are in PPE. We have processes and procedures in place in order to eliminate your exposure to other individuals. And we've said it in the past at these pressers. I know Russell has, that really, you know, even inside your hospital, sometimes that's the safest place because we have all of the mechanisms in place to protect you. And so I would say no. If you need the treatment of the emergency room, you should definitely come.
Yeah, and I would definitely echo that, and I'd go a step farther to tell you that going to the grocery store, going to the gas station, going to Walmart is going to be more unsafe for you than coming to our ER. Our ER is safer than those places because of the amount of precautions we take to screen patients, to hand wash, to mask, all of those things. So without a question, if there is need, an appropriate need for emergency room services, we strongly encourage people to still seek those care.
Okay. Well, thank you all for your time. I appreciate it. That's all I have. So.
Thanks, Mike. Next one I've got is Andrea from CBS 7.
Okay. Okay. My first question is for the mayor. Have y'all issued any citations about the mask ordinance that you know of?
I can check. I don't know offhand. Usually that stays with PD or whoever. So I can check into that and have Devin give you a call back.
Thank you. That would be perfect. My next question is for Eddie. Is it still the case that we don't have any active cases right now in the Ector County Jail?
Well, we still had some cases last week, last I talked to the sheriff, but they haven't increased.
They haven't increased. Do you know how many cases are?
They were at 10
they haven't
last week.
10. Well, okay. So not any more, not any less. You
right.
know.
Well, some could have dropped off by now, but no more than I know.
Okay. Okay. Thank you. My next question, this is for the hospitals. As we see more news reports coming out with state media that says, you know, the hospitals in, you know, down south and Hidalgo County really getting hard hit. Is there anything that you're learning from their experiences? Have you changed anything from, I don't know, like on network or anything like that?
I personally haven't networked with anyone down in that area. We network with a lot of our CNOs in our region to kind of see what we're doing. And we have reached out to some of the Houston systems, such as we talked to Medical City just recently, just to kind of take some of their best practices and see what we could tweak here on our end and what we're doing well that they can do. So we do share information like that, but I have not spoken to any of them down in that region.
So there is a
Okay.
Texas Hospital Association call that happens every Tuesday and Thursday afternoon, and hospitals across all of Texas from different regions participate. So in that call, they share a few of their successes, they share a few of their challenges, in addition to giving a status update on how their community is doing. So we do hear from people all over, and it's divided into regions, and they call on each regions to sort of report. Russell usually is on that call as well. So we do get some of those updates from that call from the other regions.
Cool. And then I have one last question, and it's for Kristen. You mentioned that you have a some for the mothers and infants.
Nothing. We're following those same procedures of isolation. And that's all dependent on the symptoms and the testing that we do with those patients. But all of the staff and the limitation of the visitation is still in place with our masks, gowns, gloves, eye protection. So we do the full PPE just like we do on any other COVID floor for those patients as well.
Is this the first infant you've treated like this young? Is this the youngest COVID patient you've seen?
It's not. We've had a couple of infants here in our facility born to COVID positive moms. And we've had a couple of pediatrics. And so we've had a little bit of both throughout our last few months.
Okay, thank you. That's it. Thanks, Trevor.
Andre, I did get an update from the law enforcement center. They are down to 3, and they're all inmates. 3 active cases, and they are all inmates.
Thank you so much for that update.
Thank you, Andrea. Next up will be Danny.
Commissioner Shelton, with school opening August 12th, there's an issue with students that have devices that live in West Odessa that have poor quality internet service. Is the county going to try to do anything to improve the broadband situation so that in the event as they go to remote learning, can you help them out with increasing the broadband?
Well, the county doesn't have anything in place currently. I have been in talks with other organizations with ECISD, sent them to me about determining what our broadband capacity is and how we can help with the situation. So we do know that it's out there, and they are looking at ways to increase the infrastructure so that they can get better broadband. But as currently, the county doesn't have anything in place.
So there won't be anything like an incentive, like a financial incentive to the business that works West Odessa, the internet service in West Odessa, to fund any money?
Nothing. There's no monies currently allotted for that. No.
Danny, the city's been working with ECISD. Right now, the number is about 39% of the students that go to ECISD do not have adequate Wi-Fi at home or broadband. The school district has submitted a plan to a panel of experts, and they are looking over the plan because it's something you need to reach out and get some expertise in. But their plan is out right now, and it should be coming back. There was a study done by Motran to be able to look at the area, look at our companies that sell Wi-Fi, and all of that is a pretty in-depth study. And so we're going to hopefully get ODC to be able to work with the school district to be able to expand that, whether it be incentives to the company or, doing some of the work ourselves. It's really all up in the air right now, but the kids are going to be able to go to the campuses and be able to get Wi-Fi on the campuses. And I believe they may be setting up some different areas for hotspots, but school district's probably the best right now to ask on that.
All right, that's all I have. Thank you.
Thank you, Danny. Next up, it looks like I've got is Mitch.
I'm okay today. Thanks, Al.
All right. Mitch. And then the next I see is Violet, Channel 9. Violet, do you have anything?
Yeah, sorry.
No worries.
The mute button. Just a quick question on employment for the hospital. We did a story earlier in the week on MMH, and they've had a lot of their staff test positive. So they're looking at, temporary hiring and different kinds of things because they're short-staffed. I was wondering if you guys have any sort of similar situations going on.
For Medical Center, yes, we did a story last week, really asking our community to step up. We know we have a lot of heroes that work out there from the nursing and respiratory standpoint that maybe are retired or not retired, but just not working, and they still have active license. We also have a few that are out as well, so we're seeking travel staff. We are offering different incentives. And then, of course, using our community people, which we've had 3 or 4 apply to say, we are active, we can come back to work, just tell us where you need us. So yes, we're in the same situation as Midland. And when you have companies such as Baylor requesting 800 travel nurses, it kind of limits the pool in which you can receive applications from. So we are trying to be very creative, doing some cross-training, using our leadership that are in non-bedside positions to help the staff on the floors and work those shifts as well.
And this is Stacy. It's very similar for Odessa Regional as well. We've talked about this, I think, several times. As Kristen just said, we do try to use clinical staff that are working more in desk positions now to step up and help where they can. Sometimes that may mean that they're task nurses as opposed to taking a full patient assignment. And so we've had a lot of success with getting additional resources that way. And we have also secured quite a bit of agency staff just to help us, especially not so much last week, but the 2 weeks prior to that when we were really seeing the cases surging at both hospitals. We started working very diligently at that time to get agency staff here, and we started seeing them come through last week and quite a bit more this week as well. So we feel that we're in a good position as long as we can continue to control the surge.
Thank you, guys.
Anything else, Violet? Okay.
That's all.
All right. I think that's pretty much everybody. Does anybody that's in the room right now have anything they'd like to add before we finish this up? All right. Kristen, did you want to finish us off today?
Sure. One of my favorite verses that we've used many times just in my own devotions for COVID and not knowing what tomorrow may bring is Jeremiah 33:3. Call to me and I will answer you and tell you great and unsearchable things that you do not know. So, y'all have a great day.
Thanks, everybody. We'll be back Friday.
Thank you.